Mouth taping. Yes, mouth taping. I cannot believe this is being talked about on social media. Yes, people are literally taping their mouth shut. Not because they talk too much, not because their partners beg them to, but because apparently it can fix your sleep, your gut, your health, your breath, and maybe even your life. I know. It sounds like social media wellness went off the deep end. But here's a twist. Science may actually back it up. That's crazy. Let's unravel this tape trend, and I'll tell you exactly what the science says, and if I recommend this as your poop guru. Guys, let's figure out what the heck is going on here. Howdy, I'm Dr. Islam, board certified gastroenterologist trainer at the Mayo Clinic. Visit us at LubbockGastro.com for more information to get your gut taken care of, to get you on the right track, and get you feeling better. All right, so I've seen this on social media, and I always wondered, what does the actual science say when it comes to mouth taping? Does it work? And guess what? You'd be surprised. There's actually not a lot of studies suggesting or even studying the idea of mouth taping. I don't think people are in a science conference thinking, I wonder, well, can we tape our mouths and see if we can come up with a scientific study? No, you're right. There are not a lot of studies in which people actually did this. But here's what we do know. In a 2020 study published in PubMed, they found that children who breathed through their mouths had a different oral microbiome than those children who didn't. And so did you even know, first of all, you have an oral microbiome? Yes, you do. What actually goes on in your mouth can actually affect what goes down in terms of your gut as well. There's a connection between the two. And this study did show that those people who did breathe through their mouth had a much altered oral microbiome than those individuals that didn't breathe through their mouth. So what's the big deal about that? Well, that gut microbiome actually was causing detrimental problems to these kids. They had more pathogens and more bad bacteria, which led to problems down the road in terms of oral health, cavities, gum disease, all problems just like that. And another study showed that the oral cavity, which in actuality is where digestion actually starts, is linked to systemic diseases like inflammatory bowel disease, rheumatoid arthritis, and even Alzheimer's disease. Now, keep in mind, these are early studies, and like I said before, we don't know a lot about the oral microbiome, but at least it gives us some connection about what's going on inside the mouth and how it can affect other bodies. And digestion actually does start in your mouth. If the oral microbiome is disrupted, absolutely, your gut can be disrupted as well. So is there a connection between the mouth and the gut? Is there whatever happens in here, will that affect in your, kind of what's going on down below? And the answer to that question is yes, there is. A 2022 study showed that about 50% of colon cancers actually contain a specific bacterium called Fusobacterium. And this bacterium is actually not native to your colon. Guess where it's native at? You know the answer here. It's found in your mouth. So somehow the mouth microbiome got translocated into the gut, and those individuals who had this in the gut had a higher chance of developing colon cancer. So this tells us there actually may be more of a connection between the oral microbiome and the gut microbiome. In fact, your mouth actually may seed some of the bacteria that goes into your gut to lead to problems down the road. And so if your gut microbiome actually is not working correctly, or you have bad bacteria in that oral microbiome, that could also be manifested with problems inside your GI tract. And this can impact all sorts of problems, especially when it comes to inflammation, autoimmune diseases, and even cancers. So what does this have to do with mouth taping? Well, let's talk about this. We do know that in those studies, that those individuals that breathe through their mouth had a change in their oral microbiome. And we're seeing more and more evidence of the connection between the oral microbiome and the gut microbiome. And there are some studies suggesting that a change in that oral microbiome for the worse can lead to problems in your gut. So what does mouth taping actually do? So number one, obviously, it forces you to breathe through your nose. You're not just sitting there just having all that bacteria just go into your mouth and altering what's going on up here. But also nasal breathing actually can help out in many different ways. Number one, obviously can filter toxins and allergens. Number two, it can warm and humidify the air that you breathe. And number three, it keeps your mouth from drying out. And this shift of actually reducing the way you breathe through your mouth can actually affect the way you sleep affect your oral hygiene, reduce bad breath, and overall can improve the quality of your gut bacteria to improve your gut microbiome. In fact, there are a lot of problems we're seeing with actually mouth breathing itself. Things can include daytime fatigue, dry mouth and cavities, sleep apnea, and then things like that. And like I mentioned before, we've seen some connection between the oral microbiome and the gut microbiome as well. So the question is mouth taping safe for everyone? The answer to this question is no, it's not. Not everyone should try this. So there are a couple of people at which I would not recommend doing mouth taping on. So number one, if you have some sort of cold or sinus infection, if you have an infection, your body doesn't want to cut off one of the reasons or one of the ways you're breathing. And so just make sure you can always have that mouth open in case you do need to breathe. I mean, if you have a stuffy nose here, it doesn't make sense for you to tape up your mouth and then all of a sudden you can't breathe. That's not good for you. It's not good for me. Certainly it's not good for anybody. Number two, if you have some sort of nasal blockage or nasal polyps, anything that can obstruct the passageway of air through your nose, you certainly don't want to be blocking off your mouth so you can't breathe. Number three, being obese. So if you're obese, you have a higher chance of obstructing your airway. And if you close your mouth and you're obstructing your airway, once again, that's not a good thing because you're not going to be able to breathe at all. Number four, if you have severe lung or heart disease, because that can put added strain to your heart and lungs. And then lastly, if you've been drinking or taking sedatives, if you're suppressing yourself by taking sedatives or alcohol, you're going to suppress your respiratory drive as well. And you certainly don't want to block off one way you can breathe by having that particular condition that's there. And specific to the gut, mouth breathing can actually make your IBS symptoms a little bit worse. Hear me out here. So you know that one of the more common reasons why people have bloating, distension, and nausea is a condition called aerophagia, where you are literally swallowing a lot of air. People don't realize how much air they're swallowing when they're talking, doing YouTube videos like this, eating, drinking. I mean, I'm burping right now. Excuse me. I'm talking too much. But also, whenever you're breathing through your mouth, you're actually swallowing a lot more air than what you realize. And that air has to go somewhere. And for a lot of my patients who have IBS, that extra air gets trapped in their gut to make them feel bloated, distended, have a lot of gas in the morning, a lot of farting, a lot of flatulence, because that air ends up being inside that gut. And when you have IBS, it already predisposes you to capture that air, holds it in there, and also cause you to feel that air a lot more often than people who don't have IBS. In addition to, sometimes mouth breathing can lead to a lot of stress and anxiety, which also is a trigger for IBS. This is why one of the treatments for IBS actually is taking deep breaths in through your nose and out through your nose to help stimulate the parasympathetic system. So by actually doing mouth breathing, you can be helping your IBS in two ways. Number one, by minimizing the amount of air that you actually are swallowing, but also number two, give you some sort of meditative effect by having you breathe through your nose to allow it to do it in a more calm manner. So big question, should you consider doing mouth taping to help out with your gut, with your oral microbiome, and also if you have IBS? So here's my take. If you're a healthy individual who has a normal BMI, doesn't have a sickness, sleep apnea, doesn't have any nasal congestion, blockage, or nasal polyps, I would try it and see how you do, especially if you suffer from IBS, with bloating and distension. See if it helps out with energy, with sleep, and just helping out with your overall gut health. It's cheap, it's easy, you just put some tape over your mouth, and that's it. But if you fall in one of those categories in which you may be a risk factor, don't do it, skip it. It's not worth stopping breathing by taping your mouth. I would never recommend that. And keep in mind, your health isn't a trend. Anytime you want to try something new like this, always talk to your healthcare provider first to make sure you are healthy enough to do this, to make sure we do things safely for you. So we're learning more and more about the role between the oral microbiome and the gut microbiome. I wouldn't be surprised if on future videos we have more information and more studies about the connection between the two and how intimately they are in terms of what they can affect, how you feel, and how it can change your reaction when it comes to eating certain foods and how you feel overall with your gut. Thanks for watching, and if you tried mouth taping, I would love to hear your experience. Comment down below, let me know what you think. Let me know what your feelings are. Let me know if you tried it, if it worked out with your conditions, or if you may notice a difference when it comes to sleep, health, or just overall wellness. All right, so thank you for watching. Don't forget to smash that like button, like, share, and subscribe, and visit us at LubbockGastro.com for more information. We love to be a partner on your health journey to get you feeling better, find out what's going on, maybe give you tips like closing your mouth when you breathe, to hopefully help out when it comes to your gut issues. So thank you for watching. Look forward to seeing you guys on future videos.